opposition leader Pierre Poilievre has weighed in on the issue of involuntary care for people suffering from mental health and addiction issues.
I believe for children and for prisoners who are behind bars, there should be mandatory drug treatment when they are found to be incapable of making decisions for themselves. For adults, again, I'm still doing a lot of research on how that would work.
This issue has become an intense debate in a number of provinces, particularly, for instance, in British Columbia, which we've talked about before in this show. Now, the mayor of Brampton, Ontario, Patrick Brown, is adding his voice to those pushing for involuntary treatment options. He's calling on the province of Ontario to start a pilot project in his region, in Peel region. I spoke with him about the idea earlier. Mayor Brown, thank you for being here. Appreciate it.
My pleasure.
Why do you think involuntary care is the answer in your region, whether it be to toxic drugs or perhaps other issues, mental health issues as well?
Well, I think it's one tool in the toolkit that's necessary for a broken status quo. The status quo is broken with addictions. We are seen in plain sight. And unfortunately, it seems as a society we're accepting it, almost daily fatalities in homeless encampments, in our own communities. It's 22 fatalities a day in Canada. And when I look at the data from the police, from the paramedics, from the hospital, it's staggering. I don't want to continue down this broken path. I want to try something different.
In your op-ed, you talked about how mental health and toxic drug arrests amounted to more than $12 million in officer time between 2020 and 2024. How would involuntary care, like forcing people into care, affect that? Do you think officers would spend less time on these issues? And if it's not them, who are the people that are going to take these people and say you need to go get help?
So our chief of police, Nisha Indirappa in Peel Region, wrote a letter to our regional council in support of involuntary treatment, or as our mental health minister, Michael DeBola, likes to say, compassionate treatment. And in the police chief's letter, he just highlighted the data. It was 150,000 hours of police time over the last 2 years. 30,000 police hours waiting in the hospital, to the point that we don't have police officers able to respond to other community safety issues. And I think his point was let police do police work. Right now, they're spending a huge amount of time on repeat mental health apprehensions. We had 7,000 repeat mental health apprehensions in the last 2 years. We had one individual in my community who was arrested under mental health apprehension 53 times. And so if a first responder comes to the scene and there's someone who clearly is in the need of treatment, it wouldn't be the police officer waiting in a hospital where treatment isn't available. We'd actually have investments in treatment that could be available where this person in crisis could be given the care they need. And I think the challenge right now in Canada is you have police officers doing healthcare work, and we have inadequate funding levels for treatment. And so I think involuntary care needs to come with significant investments in treatment. And what really caught my attention was what was announced in British Columbia when the premier there said this can't be a tool in isolation. It needs to come at the same time with new investments. And that's what we're advocating for in Brampton.
Yeah, I was going to say, involuntary care doesn't make sense if you don't have places to put people. So you're right. You would probably need investments on that front as well. I'm sure you know that people who are not for this idea cite constitutional issues, humanitarian challenges. Like they feel that people should be able to make decisions for themselves. How do you respond to some of those concerns?
Well, an analogy one physician used with me is if someone's having a heart attack and doesn't know they need to go to the hospital, you're still going to take them to the hospital. There are circumstances where the toxicity of these drugs are so powerful. 9 out of our 10 opioid fatalities are from fentanyls. They're so dangerous, so lethal that they're unaware of the fact that they could be on the verge of taking their lives or frankly taking someone else's life. And it's why I think we need a new approach for those that say we can't, we're just going to continue with the broken status quo. That means 22 fatalities a day, and it's growing. Like in Peel Region, the number of fatalities year after year is growing. And so I've just said enough is enough. we're suggesting a pilot project. If the pilot project works and saves lives like it has elsewhere, then great. And maybe this can be expanded elsewhere. If it doesn't work, then back to the drawing board. But I just don't want us to throw up our hands and say that we accept a status quo that is inhumane. How can a society as prosperous as Canada accept 22 overdose fatalities a day?
Yeah, in British Columbia, as you say, they are trying this, but they also have the highest rate of holds on people. So if a doctor in a hospital is concerned about someone's well-being, they can keep them in the hospital, and they do that. Does that not exist in Ontario, or are doctors not allowed to try and keep patients who might be of a danger to themselves in the hospital?
Well, first of all, there's not enough physicians available that are able to provide treatment, but we do have a 72-hour hold. Yeah. And obviously, I think it's been illustrated in Canada that that's inadequate. And quite often, these individuals are simply abandoned and don't get the treatment they want. And you look at the case of, obviously, the high-profile case of Brianna McDonald, the 13-year-old in British Columbia, and we don't want to see other preventable tragedies like that.
Have you heard from, I guess, first and foremost, the Ford government or the federal government about your request for this?
Mm-hmm. Well, the permission would come from the provincial government, and I know I've certainly heard from some in the government who love this idea, who think it's time to give this a try. But I think they're going through their own internal deliberations about whether this is something that they want to give a go. But there are certainly ministers that support this.
Pierre Poilievre this week was asked about it, the Conservative leader, and he said he supports it for children and those who have already had problems, but he's not sure how it would work for adults. Do you see that same complexity? Like it's easier to do for a minor or someone who's had incarceration before, but forcing adults into treatment is problematic. You can see how it would be a problem perhaps for them as well.
As this may be tested in the courts in New Brunswick and British Columbia that seem to be more advanced in this, I think we're going to understand what the legal framework is, what's permitted, what safeguards are required. There's some talk, it may be the first responder who recognizes the person is in crisis on the verge of taking their own life or someone else's, but ultimately it should be a physician or maybe even two physicians that have to sign on to the fact that this person needs to be involuntarily held for treatment. I think we do need to have rigorous checks and accountability on this. But there are other regions that we can learn from. You look at the success of this in Portugal and other parts of the world. I do believe that it's time for Canada to look at those examples. One of my favorite public servants of all time was the late Bill Davis. And he used to always say to me, there's no monopoly on a good idea. And if there's something that works for addictions elsewhere in the world, we need to be giving it a hard look, because what's happened in Canada isn't working.
Mayor Brown, thank you for your time this morning. Appreciate it.
My pleasure.
Kathy Moreland has experience with addiction and the issues that can come with it. She lost her son to it, and she's part of a group called Mom Stop the Harm and has concerns about this issue of involuntary care. Kathy, good morning to you.
Good morning. Thanks for having me.
Yeah, thank you for joining us. And obviously, I'm so sorry about the loss of your son who died of fentanyl poisoning. Tell me what you dealt with him and trying to get treatment for him.
Well, Austin was 16 years old when he first started using, and it happened very quickly. He was hanging out with some people, and they introduced him to methamphetamine, and within a weekend he was addicted. So for about a year and a half, we were on sort of a roller coaster of trying to get him assistance. He had a coexisting mental health issue. And when he decided he wanted to try, and even when we were trying to find treatment for him, he was considered to be too old for youth treatment, too young for adult treatment. And on top of that, any of the youth facilities would not accept him because of his coexisting diagnosis. And they said, we don't. And his coexisting diagnosis was fetal alcohol spectrum disorder that he was diagnosed with after we adopted him. And the only other options we had were private, and the private facilities lacked psychiatric care. They wanted $50,000 a month for the care. And we were told that if he withdrew consent, that we would not get any refund whatsoever. And I knew, given Austin's anxiety issues, that would not. he would withdraw consent probably day two.
Right.
Like he would have one night and then, yeah. And they weren't going to accommodate any of his needs. Like he needed to wear headphones all the time, things like that.
And,
So
and
it was,
you're sorry to interrupt you. You're a nurse, so like you know a little bit more about the healthcare system than perhaps the rest of us. So if involuntary treatment was in place, is that something that you think would have helped your son?
the thing I think people need to understand is involuntary treatment is already in place. The Mental Health Act allows for the holding. And I was listening to Mr. Brown's interview, and 72 hours probably isn't enough, but it's such a complex issue that I think our politicians are looking at a very simple answer, like get these people off the streets, get them help under the guise of compassion. Certainly there's pressure on politicians to clean up our streets, as they call it. But the idea of, we know from the evidence, in fact, there's a study from December of 2023 done in the Canadian Journal of Addiction that shows that it looked at 42 studies and only one of them showed sobriety as a positive outcome. So 350,000 people in a systematic review were looked at. And so if the goal of this is to get people off the streets, you may accomplish that for a short period of time, but once people are in involuntary treatment, their risk of dying from these toxic drugs is much higher, because unless you have the wraparound supports in place for them after they completed treatment, it's highly likely they're going to overdose, given the nature of the disease. And I've often said to people that addiction is not the problem, the toxic drug supply is the problem. So we know with any form of addiction, whether it's alcohol, cigarettes, sugar, anything, that people have to stop and start and try over and over again. But the problem with this situation is the drugs are so toxic. So
it does seem as though this is like part of the new, as you say, conversation politicians are having in order to try and deal with the mental health crisis and the addiction crisis. What do you think would have made the difference for you and for your child?
Austin was apprehended on a Form 2 and brought into hospital on with my hopes that he would be put on a Form 1, which is the hold. Right. I think until our healthcare system treats substance use disorder as a healthcare condition and not a criminal issue, and that there are the resources in place for youth, particularly, and adults to be given treatment that they need and given those options, and that there's, again, wraparound services afterwards, then I think that would have made a huge difference. If Austin had been into treatment, I don't know, I will never know if he would have relapsed over and over, because we know that that's often the case. I know many mothers in Mom Stop the Harm who mortgaged their homes to the hilt and put their children into care many, many times. I know many whose children died before they could get into treatment when they wanted treatment. So the thing I'm concerned about is if they decide that they're going to do this, what about people who want treatment? Are their beds going to be used by people who are now on involuntary treatment? There's just so many parameters to this that have to be considered. So it seems like, but I think politicians that were coming into a voting time, and federally probably and provincially, that they're using this rhetoric to appeal to a public that doesn't understand just how complex this issue is. I've had people say to me, well, if he just had stopped, it wouldn't have hurt him. When people say to me if they just stopped, I said, do you go and get your coffee every morning? Like people don't understand addiction.
No, Kathy, it is such a complex issue. I wish we had more time, but I really appreciate you telling us your personal story and weighing in on this issue. It's super important. Thank you for making the time for us today, Kathy.
Thank you so much for having me.
Okay, thanks very much. That's Kathy Moreland.